Hello and welcome to the Dubai Science Park podcast. I'm Dr. Sheen, your host, and today we're here in the Dubai Science Park at the GCLS Health and Longevity Summit. My guest today is Professor Edward Kunonga, and I'm super excited to talk to him everything about population health, aging, and longevity. Hello, Edward. How are you?
I'm great, thanks, and thanks for having me.
Of course. How has the morning been at the summit?
It's been fantastic. I think the presentations really stretching your mind in terms of what people are doing. I've been fascinated by the advances that are happening in longevity medicine.
And is this the first time you're experiencing the Dubai Science Park?
It's the first time, yes,
Yeah.
and definitely not the last.
Of course. And what do you see, whether it is the Dubai Science Park or this summit, what do you see they're doing right when it comes to the conversation around longevity and aging?
Well, I think getting people together in a room to share the developments, the innovations, but also the questions that we still have remaining is fantastic. So I think seeing people from across the globe sharing what they have been doing, both in terms of presentations, opportunities for networking, I think that's amazing. And we need to do more of this because clearly longevity is the hot topic at the moment, and we need to get our minds together to ensure that we get it right for our populations.
Absolutely. And tell us a little bit about yourself, Edward. What do you do?
So I'm a public health specialist, worked in different public health roles as a director of public health. So my most recent was being the director of public health and well-being for NEOM out in Saudi Arabia. Prior to that, I worked in the UK as a regional director of population health management in the National Health Service. I've worked in hospitals. I've worked in administrators, I've worked in payers, and I just have a passion for making a difference for people.
Okay, and what is your main focus of interest at the moment when we're talking about public health?
My main focus is about systems.
Okay.
So how do we ensure that we pull together all the different levers in the system so that we can achieve better population health outcomes? Because the challenge we have is that we can all pull in different directions and be pedaling harder but not making any progress. So my interest is how do we join up systems so that we align our efforts and we achieve improvements, not just for individuals, but also for populations.
And as you mentioned, longevity is the new hot topic that everybody's talking about. What do you think the region is doing right when it comes to pulling the right levers, as you're saying, or setting the right systems when it comes to longevity?
I think there are lots of things that this region is doing well. I think they have managed to leapfrog a whole range of other health systems that have been grappling with this issue for a long time. Because let's not forget, we are only a few decades away where in this region, the major cause of death was infectious diseases.
Wow.
Where people were dying from infections, where people were dying from things that could have been prevented. And for them to have done that epidemiological transition from a biggest burden of disease being infectious disease to now be talking about non-communicable diseases is commendable. And not only have they changed the epidemiology, they are now even pushing the boundaries to say, what can we do to prevent disease? What can we do to detect it early? What can we do to support those who are living with disease to optimize? And what can we do to give people not just length of life, but let's give them quality of life? And I think this whole interest now in health span, as opposed to lifespan, is a very, very important and interesting concept from many, many regards.
Yeah.
I mean, from it's the right thing to do to actually, it's an economic powerhouse. A healthier population is a much more productive population, and it will drive their economic ambitions as well.
Absolutely. Yeah, because I think people get the whole longevity thing confused, but they think we're just trying to make people live longer, but we're trying to help people live longer, healthier lives, right? So again, my question is, we do say that aging is the next global crisis. What's the one thing you think governments must fix now so that we age healthier, as we said?
So I think, governments are best placed to create the environment that enables individuals to live as much fulfilling lives as possible. But to do that by organizing efforts of whatever their ecosystem is. And I think there are many, many different fronts where governments can play a lead role. The whole agenda about quality of life, whether you call it aging or longevity, shouldn't just be about medicine. It shouldn't be about fancy biomarkers, important though they are. It shouldn't be about what is the latest supplement. It should be about an organized whole of government and whole of society approach. The reason why I say that is health is not made in hospitals.
Yeah.
Health is not made in lab tests. Health is created in the places where people are born, where they live, where they work, how they travel. All of those things are the key determinants of health. And I think governments are the place shapers. They make policies that determine where you live. They make policies that determine how you move. They make policies that determine what food is available. And without that governmental input, we run the risk that longevity becomes the preserve of the few who can afford it. Those people who can afford the latest tests, those people who can afford to eat whatever diets, those people who can afford whatever infusions, even though the jury is out on some of them. But those who can afford will continue to have improvements. And those who can't then become left behind. And we can't afford to leave communities and populations behind.
Yeah, that's such an important conversation. And again, because the other hot topic is AI, and AI in medicine and healthcare has become something we're all discussing. And we're all a little bit worried about what does that mean when we're talking about AI in medicine. And is that a good thing, or will it further widen that gap between people who can afford healthcare versus cannot afford healthcare? What do you think?
So I think in every generation, there is always a new innovation that comes up with lots of challenges, but many opportunities. And we can go back to innovations even within my lifetime. So things like the arrival of the internet. I remember very well lots of things being talked about. The internet, is it good? Is it bad? Mobile phones is another example. Computers, when I did my first degree, I remember having to queue at the library to have my turn to type my dissertation.
Oh my God.
Because I didn't have a laptop. Nowadays, most people can afford those.
Yeah.
So I think we need to view AI with the same perspective, that it has got a lot of potential. There are still lots of unanswered questions, but that shouldn't mean that we push it away. I think that means that we just need to work our way through it, because it does have its place. The computational power, the ability to use large language models to answer things that would have taken us ages, surely that's a benefit. But it has to be done responsibly. It has to be done in a way that people can trust it, they can be confident. And also it has to be done in a way that does not cause harm. Because in the wrong hands, with the wrong approaches, it can damage people's lives.
Absolutely. Like everything, it needs to be properly, the ethics and the laws need to come into place. But now, Edward, you literally work at the intersection of data, governance, and frontline health outcomes. What have you seen in your experience where most health systems fail when they're trying to translate population-level insights into real-world change?
So I think there are a number of challenges for systems. The first is that some systems are systems by name, but actually they are vertical silos. So when you look at most countries, when you talk about the Ministry of Health, it will have many vertical silos. It will have the big hospitals, it will have community care, it will then have rehabilitation, all described as a system, but not really interconnected. So we need to think about, when we're designing systems, how do we ensure that we're not creating silos, we're not creating these giant parallel swim lanes that create problems for populations. The other challenge is the fascination with treatments, whether it is advances in whatever treatment or building new big and shiny hospitals. If you go to any big city, you will see big, shiny hospitals. But health does not happen in big, shiny hospitals. Health happens in communities. And I would like to see, and there are encouraging signs globally, where people are beginning to shift the focus, that healthcare should be delivered first in the home, in the communities, the places where people live, and only in the exception that people should then go into hospitals. So I think we need to see that paradigm shift, that the spend, I remember reading a WHO report on international spend on healthcare. It is skewed.
Yeah.
Most people spend money on hospitals. I did a talk in Cape Town looking at the financing gap in Africa as an example. And we did an analysis of government spend on where do governments spend their money. Well, it is not in health, and that's a topic for a different day. The second one is the spend that is spent in health. A lot of it goes in big and shiny hospitals. We need a different model for delivering healthcare. Not everyone can get to a hospital. Even if they could, surely we would need to have massive hospitals if our delivery is going to be focused on delivering from hospital settings. And we couldn't afford it either. So for me, I think we need a paradigm shift in terms of what is our view of health. How do we really work on health? I did another interesting talk with postgraduate students where I proposed that if I was going to do things differently, if I ever was given the opportunity, I would abolish a Minister of Health and I would make health everyone's responsibility because your treasury or a Minister of Finance is the biggest health department. The decisions that they make on education, on agriculture, on transport budgets have got a bigger impact on health than the little amount they give to hospitals. So I think when we talk about systems, we have to think beyond the very obvious. When we talk about health, we're not just talking about health care. In fact, that is sick care rather than health care. Health is more than when people are ill. I mean, I could wax lyrical on this because clearly it's an area that I'm passionate about. But I think we need to rethink how systems are configured. We need to rethink what do we mean by health, and we need to think about the different players who can contribute to the health agenda.
Yeah, and even the needs of healthcare changes, right? As you said, if we take a random country in Africa compared to a country in Europe, it's not the same needs in terms of healthcare. So trying to fit in the same system everywhere also will not work, which is why we need people who are on the field to actually come forward. So now looking in the future, based on all your experience, and we've had a pandemic, which now has been 6 years ago, feels crazy to say that, with all the climate threats that are coming and our aging populations, where do you think global health collaborations should be focused on in order to make the fairest, but also the fastest impact?
I'm glad you brought up the pandemic because I think the pandemic just helped us to understand how interconnected the world is. And we were all in it together, as politicians would say, but not really, because we then saw people acting as though disease respects geographical boundaries. And so we had the UK unashamedly proclaiming that they've got enough vaccines for all of their eligible populations. And then we had some countries not having any vaccines at all. And I think whilst that was kind of a pandemic response, it just tells you something about what we need to do globally, whether it is for a new and emerging infectious disease or it is for pre-existing kind of chronic conditions like hypertension. We need to work more collaboratively across the world rather than each country trying to look after what's happening in its own boundaries. The world is a lot more connected now, and what's happening in my home country in Zimbabwe will have an impact on what happens in Dubai, and it will have an impact on what happens in the UK. So we need to think more globally. We need to think more being interconnected. But for me, fundamentally, we need to think more about equity and fairness. Is it right that the quality of life, the length of life you expect to live from the day you are born is determined by where you are born? Is that the world we want to live in, where chances of you making it in life are determined by where you're born and not necessarily about being on an equal playing field? And I think that's the challenge for me that gets me up every morning to say, surely I want to play my part in ensuring that every individual, every community, every population is provided with the support to have the best possible attainable health, because health is a human right.
You've asked a very important question, and I think we're going to leave it on that so everybody can think about this and dwell on that question. Thank you so much, Professor Edward, for being here today. This was a very enlightening conversation.
It's great. Thanks for having me.